A new variant of the COVID-19 virus is quickly becoming dominant in parts of the United States. It's a subvariant of Omicron known as XBB.1.5.
This is a new emerging subvariant, and it has risen very quickly across the country. It's gone from being almost non-existent a month ago to now making up a large portion of all the infections.
In December, it went from accounting for just 4% of U.S. cases at the beginning of the month to 41% by the end of the month. By some estimates, it is now the dominant strain.
It is the most transmissible subvariant that has been detected yet. And we are concerned about its growth advantage. In particular, in some countries in Europe and in the U.S., in North America, particularly the northeast part of the United States, where XBB.1.5 has rapidly replaced other circulating variants.
XBB.1.5 is transmitting quickly, even among those who are vaccinated or were previously infected. But there's no evidence currently to suggest it causes more severe illness. Public health officials say vaccines are still the best approach to avoiding the most severe outcomes.
The way the vaccine is working extremely well is to protect people against severe disease, hospitalization, and death. And the vaccines continue to work very well against all Omicron variants that we've seen so far. What the vaccines are not doing anymore well at all is stopping people from getting infected.
The World Health Organization is suggesting increased precautions for travelers, but is not calling for travel bans or testing requirements.
When it comes to other measures, WHO's recommendation is that passengers should opt to wear a mask in high-risk settings, such as long-haul flights, and this should be a recommendation issued to passengers arriving from anywhere where there's widespread COVID-19 transmission. And pretty much that's across the European region, that's across the Americas.
Over the last 2 weeks, COVID-19 hospitalizations and deaths in the United States have been rising as people return from holiday travel. In some areas, hospitals are again reaching capacity, and public health officials are concerned the emergence of XBB.1.5 will further fuel the surge. Jim Spellman, CGTN, Washington.